Welcome to EQUUS Farm Calls, where we take horse owners along with us to discuss important topics on equine health and care with industry experts. Today, we're talking to Dr. Marcio Costa about the equine microbiome. EQUUS Farm Calls podcast is brought to you in 2022 by Farnam, the makers of cough-free supplement. Spring is here and you're ready to go riding, but is your horse? When a cough gets in the way of your horse's health or performance, turn to cough-free respiratory health pellets. Now available and easy-to-feed pellets, its unique formula contains a blend of show-safe natural herbs and minerals to provide respiratory support when your horse is experiencing seasonal allergies or stable cough caused by environmental stress or irritants. Perfect for horses that are stable or horses with restricted turnout to maintain healthy airways. Don't let pollens, dust, or other environmental pollutants sideline your horse. Tackle that cough with cough-free equine respiratory health pellets and get back in the saddle. I'm Kim Brown, Group Publisher of Equine Health Network, and our guest today is Dr. Costa, who is an assistant professor in the Department of Veterinary Biomedical Sciences at the University of Montreal. He earned his degree in veterinary medicine in Brazil and moved to Canada to complete his residency in large animal internal medicine at the University of Guelph. He completed his PhD in 2014 using next-generation sequencing to investigate factors affecting the intestinal microbiome of horses. His research is focused on microbiome manipulation to improve the health of domestic animals. Thank you, Dr. Costa, for joining us today on EQUUS Farm Calls.
That's my pleasure to be here. Thank you for the invitation.
To our horse owner audience today, let's just start with a big general, what is a microbiome?
Yeah, that's a good question. The microbiome is a definition we give to all the microorganisms that inhabit our body. So when we talk about microbiome, we are talking about viruses, bacteria, small parasites, fungi. But normally we use that as synonym to bacteria because the bacteria we judge one of the most important microorganisms and also the most studied. So normally when we say microbiome, we are talking about bacteria that are present in our bodies.
And these can be, like we talked about to another veterinarian about microbiomes on wounds, and we've talked about microbiomes in different parts of the body. But today we're talking about intestinal microbiomes. So why is understanding the intestinal microbiome in the horse so important? Like
you said, all the bacteria are very important. So the skin microbiome, the oral microbiome, the vaginal microbiome, they all play a very important role in our body and keeping us healthy. But what we have found recently is that the intestinal microbiome is particularly more important because they have different roles in health. Horses specifically, they rely, as most or all of the audience know, horses, they use their bacteria to break down fiber that they ingest. So the horse doesn't have the digestive enzymes to break those complex carbohydrates, like cellulose, for example, that they ingest with their diet, but the bacteria can do that. So that's what cows do in the rumen, and that's what horses do in their cecum and colon. Basically, those compartments are full of bacteria that will break that fiber, will digest them for the horses and produce molecules that can now be used as energy source. So the horse heavily relies on those bacteria to help them to get their energy they need. Okay, so this is the basic that most of people already know. But the most important is that during the past decades, when we talk about bacteria, we think about the bad guys, right? The bad bacteria that cause disease. And that's fine. That's what we have been studying for many, many decades, only the bacteria that cause disease. But we largely forgot about the other bacteria that are actually the majority in our bodies. So they are actually good and they are necessary for example, to regulate the immune system, not only the intestinal immune system, but also the body immune system. So they are, depending on the type of bacteria there, they're going to protect us and your horse better than other types. We know that now. We also know that they are necessary, for example, to develop the intestinal mucosa, meaning that if you have good bacteria there, your horse is going to absorb more nutrients than the ones that have an abnormal microbiota. So there are those type of interactions that we are just learning. And a big one, a very important one, is also the protective effect that the good bacteria have in protecting the horse against bad bacteria or pathogens, okay, the bacteria that cause disease. If your horse is full of good bacteria, it's less likely that he's going to have diarrhea or develop malnutrition or malabsorption. So those good bacteria, they are actually competing with the bacteria that can cause disease. And like I said, there are many instances where a horse can change the normal microbiome to, for example, when they have a course of antibiotics. What happens is that these drugs will kill a lot of these good bacteria and are going to open space for the bad bacteria to come and colonize the gut and potentially cause harm or a disease. Okay, so we are just learning now all of the importance of these good bacteria and who they are, how we best colonize horses with those good bacteria. There is a lot of research going on right now, and I'm sure that in the next few years, we're going to have a lot more information about that.
And tell us just a little bit about how the microbiome, you mentioned antibiotics, but how can you sway this microbiome good and bad? And of course, we all think as horse people about foals eating the mare's manure. So what is it? How do horses do this, and how do horse owners manipulate it bad and good? Because I know sometimes green is not always the best way to help your microbiome.
Yes. So this is the focus of a lot of research right now. What we know is that the way we treat horses, we change the microbiome they have been selected in nature to harbor. For example, if you compare the bacteria from wild horses with domesticated animals, they are completely different. Okay, so we think that the microbiome from horses in nature, and that's pretty much true for many different species, from canine to birds, they all in nature, they have a different microbiome. Okay, and what we think is that the more bacteria they have, better the microbiome, or I should say more different types of bacteria. We call that diversity. Okay, so if your horse has many different types of bacteria, it's more likely that if one species die, the other one can take over and carry on doing the same job the ones that are missing now were doing before. So we think that diversity, it's important, but we decrease diversity with the systems that we have now. For example, if you performance horses that receive lots of carbohydrates, we know that we change the populations of bacteria, the composition of the bacteria there, but also we decrease the diversity in the gut. So this is something, I wouldn't say that it's bad, but it's necessary. So we need to learn how to live with those changes and to overcome the consequences that might have to the horse. Okay. By the moment the foal is born, it's already being colonized with the bacteria that is in the environment. Okay, You might have heard that there is a lot of discussion that there is bacteria in the uterus, but this is all controversial, so I'm not going to get into there. I'm not a big believer of that anyways, but for sure, by the moment they are being born, they get in contact with the vaginal microbiota of the mare, and as soon as they start nursing, they are getting bacteria from the teat and from all over the environment, right? And after they nurse the colostrum, this has a big impact on their microbiome, the foal's microbiome. So during the first 30 days of life, this microbiota is completely different. We have a lot of antibodies in the colostrum, in the milk of the mare, and this can help shaping the microbiome of those foals. And after they start eating more and more hay and grass, this is going to change also their microbiome. And after they become 3 months old, more or less, their microbiome starts to resemble, in a big picture, the microbiome of older animals. Okay. So there is definitely a change over time of the microbiome, the bacteria present there, but also we consider that as a opportunity window to manipulate the microbiome. Okay, for example, an adult healthy horse, it has already a very well established microbiome there, which is difficult to change unless you go like with something strong like antibiotics or big stress. But if the foal has this period where many species are trying to thrive and to colonize, there is easier to go and treat them with something that we want, for example, to increase or to benefit the beneficial populations of bacteria.
And maybe we can get into prebiotics, probiotics, those kind of things in a minute, but we'll stick with our bacteria for right now. So what do horse owners need to think about? I mean, you've just told us that you can affect it by management, by feed, by treatments. So what do horse owners need to think about to promote a healthy equine intestinal microbiome?
Good question. So I teach nutrition, but I'm not a nutritionist. But what we know is that horses need fiber, right? They need pasture, they need hay. And there are like all the recommendations made by the experts about horse nutrition. You need to follow that. And as a rule of thumb, the less carbohydrates they get, the better. So we know that they can have predisposition to have colic, for example, if they get high amounts of starch or any grains or any carbohydrates in general, soluble carbohydrates in general, right? So, and that also, there is a relationship between changes in diet, the occurrence of diseases like colic or diarrhea, and changes in the microbiome. So we are not at a point where we can say there is a very clear cause-consequence relationship between changes in the microbiome and disease, but for sure they all occur at the same time. So we don't know what's the cause of or what's the consequence, but we know that they play with each other. Okay, so if I have to recommend you, is access to pasture. That's what horses have been selected in nature to do, to graze and to walk and to have small meals for during long periods. Okay, there are research showing that if you feed your horse once a day or twice a day, they're going to have changes in the microbiome, and they are also more predisposed to disease like colic or any gastrointestinal disease. So if you can feed your horse many times per day, that's the best, and with a lots of forage, so hay and pasture if available. Okay, so this would be the recommendation to increase diversity and to have a healthier microbiome in your horse.
Okay, now we have to get into it because there are a lot of products out there now, especially as humans have probably progressed more in their research on the microbiome, which always brings out more products. And I'm not saying any of these products are good or bad, but when we talk about prebiotics and probiotics and so on and so forth, I mean, what about in horses? What do we know from research in horses?
I think to start with would be a good thing to define some of those products, right? So probiotic are live bacteria that have the potential to cause benefits to the host ingesting it. So it's basically live bacteria that we eat or that you give to your horse by mouth. Prebiotics are non-digestible fibers that we can give it to the host, and the host cannot digest it, but the bacteria can. Okay, so I normally tell my students that those are food for the bacteria. Okay, you are feeding your bacteria, so you are giving them conditions to digest that fiber and multiply and thrive and do the good benefits they can do in the gut. Now, if you combine those two products, probiotic and prebiotic, then you have what they call a symbiotic. Okay, we have also products for horses that are classified as symbiotics, basically live bacteria already with food they need to grow. And a new category that is also starting to be studied in horses is what we call postbiotics. The postbiotics are byproducts from bacteria. For example, we know that a lot of beneficial species, they produce a volatile acid that's called butyrate. So instead of trying to get bacteria that produce butyrate in the gut, what people do now is to just give it butyrate directly to the horse or to humans, that hoping that's going to cause the same beneficial impact that you would have if produced by the gut bacteria. Okay, so those are the postbiotics. Now, what we know in horses, before I answer that question, I have to make a consideration that it is very difficult to do studies in horses, okay, because they are very expensive. Like if you see human studies, they're going to use 1,000 individuals. We cannot do studies this big in horses unless we do multi-center studies, but then we start to increase variables into that needs to be accounted for. So we do what we can. And the truth is that there is a lot of disagreement between studies. Okay, so there are many studies showing a beneficial impact of probiotics, for example, decreased incidence of diarrhea in foals, or decreased shedding of salmonella in adult horses. But for each study showing those beneficial impacts, there are also other studies showing no difference between the groups. Okay, and even if you go with other species where it's easier to study and cheaper, for example, calves, you're gonna see that sometimes in the same study, they give it a probiotic, they see a good impact on performance, but then right after the next batch they use it, they don't see a difference. So in my opinion, this is more likely what happened. Sometimes you do have a beneficial impact of those supplements, and sometimes you don't see anything. And that's what these studies are seeing. Sometimes they're picking one population that is more susceptible, for example, to dysbiosis. By dysbiosis, I mean a big change in the normal composition of the microbiome. So we call that dysbiosis, or an abnormal microbiota. And then you treat them and you see an improve. So it makes a lot of sense. But if your horse has already a healthy microbiome, it won't change anything if you treat them with probiotics or prebiotics, right? So this is a little bit, how can I say in English, frustrating, but that's the truth. Okay, we don't know for sure which of those drugs or supplements are good, when exactly to use. The good thing is that they cause no harm. So you can use them as your vet prescribes. We prescribe a lot of probiotics, especially like in horses with diarrhea or in foals with diarrhea. They're not going to cause any harm, at least the products commercially available. What we are working right now is that we are trying to identify bacteria that are not commonly used as probiotics. We call that novel probiotics. That with the new technologies we are using now, we say DNA sequencing, we could find that there are other bacteria, I shouldn't say more important, but more abundant in the distal gut that have maybe a better potential to be used as probiotics. So they are doing that in humans, and that's the way a lot of companies and research groups are also going to do in horses. We are trying to find novel things to treat and to prevent disease and gastrointestinal dysbiosis in horses. Okay. Now, one thing I also wanted to say is that prebiotics, those supplements, they do have a huge potential to change the microbiome. For example, just to give an example, if you treat horses with an overload of oligosaccharides, what you can do is to actually kill their cecal microbiota to an extent that you're going to have laminitis. That's the model we use to research, to do research in laminitis. We treat them with some prebiotics. We kill a lot of bacteria. They get sick. They develop laminitis. Okay, so prebiotics have a lot of potential to modulate the distal gut bacteria. So we are just learning which ones are the best, how they work, how they're going to influence each species. But there's a lot of research right now, but we're still not completely sure if this fiber will benefit only like a target species that we want. So this has to be a very specific effect of the supplement, which is a little bit difficult to have. Okay.
Be careful about this, because just you can cause harm with some of these.
Yes, if you overdose prebiotics, depending on the type of fiber, you absolutely can change the microbiota in a negative way. But those products are considered safe if used in the right dosing and concentration.
And tell us a little bit about the research that you're doing right now, Dr. Costa.
Okay, so part of the research is this, what I just told you. We are doing a vast research on the literature to gather all the information available and identify which bacteria are associated with health all over the world and which bacteria is associated with disease. What we know, for example, when horses have diarrhea, they're going to increase this type of bacteria, or they're going to decrease that other one. So we are trying to make associations to see if there is a common factor that we see in all the studies that can be associated with health. And then we are trying to culture those bacteria, like I said, to test their potential to be used as a probiotic. Okay. We also do research with what in humans they call fecal microbiota transplantation. Okay, this is another way to treat horses with dysbiosis. For example, if the horse has diarrhea, or we call colitis, so severe colitis, and they are not responding to treatment, we can try to give them they call a pool tea. That it's basically you get feces from a healthy horse, you dilute that, and you give it by nasogastric tube, and hoping that this bacteria will colonize the horse. So That has been an medical indication for humans with Clostridioides difficile infection. So they are also trying to do that in humans with many other different diseases, intestinal diseases, including obesity and many others, trying to change their microbiome. So it really works really well. For example, in human patients with diarrhea, that's already very well established and showed over and over. If you give them an FMT, as we call it for short, they're going to recover from diarrhea in the next days. Okay. We also did a study in puppies with viral diarrhea. And if you give them an FMT, they also recover much faster than the other groups. So it seems to be true to dogs and humans, but we did some studies in horses and we did not see a big difference. And there is more and more evidence showing that it's very difficult to change the microbiome doing FMT in horses, but there is also research showing you can change and you can treat horses with FMT and they can improve their microbiome. The problem is that, like in probiotics, we are starting to have like disagreement in the literature. So one study shows that you can improve and 2 or 3 others show that you cannot improve. So I know it's a little bit frustrating, my answer also, that we don't know things at this moment. We don't have clear answers at the moment. But that's why it encourages me to keep doing research in this area. That's what I like, So one problem with FMT is that you can transfer along with the good bacteria, you can transfer bad bacteria. So you have to have a very strict selection of the donor you are using. And the problem is sometimes you have a transient shedding of some pathogens. For example, Clostridioides difficile or Salmonella, one day, even in healthy horses, they can be present in the feces. Next week, they are not there anymore. So that's in a small percentage of horses, but your donor could be one of them. So you have to spend a lot of money testing the donor. The other research we do is we are doing now is to improve the viability of the bacteria to be given to sick patients. Okay, why is that? Because when you freeze the feces from the donor so that you have it right available when a patient arrives with colitis, you don't have to run to to a healthy horse and get feces and dilute them. So the recommendation right now is to filter that solution and keep it frozen. But if you do that, we have shown that you kill a lot of bacteria by freezing. So we are searching what's the best cryopreservant or preservative that you can use that will increase the viability of those animals or of that bacteria to be given to sick animals. Okay, and also we tried to establish a new protocol to concentrate bacteria and develop like a super FMT, but that didn't work well. That didn't work very well, mainly because by doing this procedure, you increase a lot of undesirable bacteria, for example, Escherichia. Okay, so we are trying many different things, but we are not afraid to say this one didn't work, so don't do that. Just because we thought it would be good, it doesn't mean it will be, right? So we abandoned this protocol, but we carry on trying to increase viability of bacteria during storage and also trying to develop new alternatives that you don't need to use to do an FMT. In your horse, you can just give the viable bacteria right away. In humans, they call that a super probiotic. If you look at the market, most of the products, they have like maximum 6 strains of bacteria or 10 if you are lucky to find a product like that, even for humans. But right now what people are doing is to developing these new products that are not considered as supplements anymore. Now they are considered as medication, and they have like 35 different species of bacteria. So they don't even like to call probiotic. They call that an ecosystem. So it's a fancy name for what I call a super probiotic. So we have this intention to do that in horses too, but we are still at the beginning of this research.
And it's something that, all of us know how important our gut is to ourselves, and we know how important it is to our horses. So we really appreciate you coming on today and helping us understand this a little bit better. And I realize that there's going to be a lot more learned about this, and I hope we'll have you back on when you've made your next big discovery and figured out how to freeze it or transfer it or increase the right bacteria or feed them better, so that we can know more about that.
Well, I'm working hard for that.
Okay, well, thank you again, Dr. Costa, for joining us today on EQUUS Farm Calls podcast. And a big thanks to our audience for listening. And we invite you to give us your input and hope you'll tell your friends about the podcast. And if you have suggestions or comments, feel free to contact me at kbrown, that's the letter K Brown, at equinenetwork.com. EQUUS Farm Calls is a production of the Equine Podcast Network, an entity of the Equine Network, LLC.